Hello, everyone, and welcome back, and welcome to the beginning of another week. I hope those of you that had a chance to relax were able to do that, and I appreciate all the people that were working hard and keeping things here rolling well, and we'll be hearing about that. And I think the theme today is going to be focused on taking care of ourselves and taking care of each other, because as we always talk about, for our patients and our families, the kids, that their mental and emotional health is as important as their physical health, and we want to, focus attention on that today and prioritize that. So we'll be taking some time to think about the well-being of our associates, and so I think it's going to be a very, very rewarding program. Before we get into that, I wanted to read another one of the thank you notes that's been posted to our Kudos board. I think most of you know now that we actually we have this Kudos board, and I'm starting to learn, but I was off over the weekend a little bit, so I'm having struggling. But there it is. The thank you board, Kudos board. You see the website there. And just wanted to highlight another one of these that came in. Thank you is not enough. 43 years ago, I had 2 babies in the NICU. I saw all the hard work and dedication of the nurses, and that was in a non-pandemic world. I cannot imagine the additional fears, burdens, and stress that COVID-19 has cast upon you, yet there you are, without reservation, and some with families of your own, caring for the most vulnerable tiny humans. May you reap what you sow 100-fold with all of these hearts. I applaud you with a bunch of claps from Jane Labrie. So think about that, 43 years ago. That was, 19, somebody help me with the math, 1977, 78, somewhere in there. So I think we had just moved to the what they called at that time the new hospital in 1976. So was anybody here then? Linda, you couldn't have been here in 1970. You weren't even born in 1976.
I'm here, but that's Tara Floyd's mother.
Oh my goodness. Oh. So Tara Floyd, who runs all of the ICUs, are just incredible nurse. So now they've pulled off the. You got to love that. So Tara.
One of them Tara. One of them was Tara.
Well, can we violate the privacy with 300 people listening? One of them was Tara. We need to get some pictures if Tara will provide those. But I think a lot of you know Tara Floyd, who runs the NICU, a nurse, manager, leader, and also the PICU now, right? She's over both. And, so here her mother is 43. Well, wait, now we can't give away. We can't give away Tara's age, so it might not be Tara. We just don't know. We just don't know. But I'm pretty sure that was before Dr. Short got here. I'm not 100% sure on that, but she could have been here then. Does anybody know?
Dr. Avery would have been here.
But Dr. Avery was definitely here. This was where the textbook of neonatology came out of, and Children's moved from what people call the old hospital in 1976 to this being the new hospital. And so it's kind of, wonderful to think about this arc of this mother had babies in the NICU, saw the hard work and dedication of those nurses, and then that her daughter would then go into nursing and become one of the great leaders. Says a lot. And I know those teams that Tara is leading now. Particularly right now, the PICU. I happen to have an opportunity to be up there on Friday afternoon and evening, where there's been a number of sick children with the virus. The spirit and the commitment, the passion was evident. You could feel it, and I think that Ms. Labrie has captured that in her note. So very appreciative of this kudos board and everything that's behind that, because it just shows us how the community is still with us. Has been for 150 years. Here's 43 years of that history, and there's going to be more of these. And just think about the kudos that somebody's going to write 40 years from now when something else comes along, and they're going to be reflecting on just the great work of the nurses, the doctors, the respiratory therapists, the emergency department, folks that are cleaning the hospital and putting their own lives on the line in their families at home to bring these great outcomes. So with that, one thing I wanted to point out as I introduce Drs. Christy Corvo and Dr. Hemant Sharma, they put together this program that's been going on now for 2 or 3 years around physician wellness. And I know there's a lot of the sponsors of that are here in the, and it went beyond physician wellness and to caregiver wellness. And Drs. Corvo, and I think we call it provider well-being now, is the formal name. And it's just having, a lot of great programs and impact. And many of you have shared in those sessions and at different times, or access to different resources that have been made available. But one of the programs that they sponsored, and it was a grand rounds, I think, about 10 days ago, that they, I think that was, or a town hall grand rounds type thing. And just got a tremendous positive feedback here at Children's National, and they asked me, well, do you think this is a good resource for the Children's Hospital Association and all of the children's hospitals? I said yes, but I don't know if they'll do that. I know they've been trying to do some things around that. Well, sure enough, they loved the idea, and this was held on Friday, and Hemant and Christy introduced the program, and I think there were somewhere between 300 and 400 top executives at children's hospitals all across the country. So this, it was really amazing. I had an opportunity to listen in on it, and it was just fantastic, and showed off Children's National and our wellness programs in the broadest way and the most positive way. So with that, I'm going to let them take on not let them, they are going to take on the rest of the program. And Gitanjali, I'm trying to say that, Gitanjali Prasad, who's the program manager, is going to be joining them in the presentation. You can see the names there on the slide. And then will there be other after that? Okay, there's a whole slate of people, but then is there an operational update, or is this it? This is it. Okay. So focusing totally on well-being. So no operational. Look for in your emails for all of that. And we'll be back Wednesday with more robust information about the operations beyond the email. So Christy, Hemant, and I'm going to go again. Gitanjali, it's over to you.
Thanks so much, Kurt. Really appreciate that warm introduction. I know you can't believe it, but I'm actually blushing. Okay, so welcome everyone. We're so grateful to have this opportunity to talk about all the good work that's happening at Children's, and to challenge us to think about how we can continue this good work for all our members of the Children's Hospital community as we move through this pandemic together. Next slide. So just to give you an overview of our work, we truly benefit from the Physician Wellbeing Academic Consortium that we are a member of. And it's an opportunity for 15 institutions across the country to share best practices. And as you all know, that the pandemic has hit different parts of the country at different times. And our hospital is a direct beneficiary of that. And one of the things that we talked about just this past Friday was how we could think about helping our staff and all our children's hospital members through this pandemic. So we're going to go over the framework that we would like us to think about well-being that we do. So, hi guys, sorry. One of the ways we want to talk about this is how we can prepare yourself and your family for the pandemic. And we are thankful for all the resources we have here at Children's National. We have our Aetna EAP. We have resources for emergency childcare benefits, home educational resources, meals and food donations, and a special shout out to Martha Pera and Leah Cuppersmith for helping organize all those people in the community who want to help and provide meals and sustenance to our workers here at Children's National. Other resources such as apparel and shoe office and transportation and lodging are all housed on the COVID website under the Wellbeing tab. So as you look to prepare yourself for what's ahead, and we are expecting that surge to come, how can you prepare yourself and your family to go through this together? Then, as you hear about daily, how are you informed when you come to work? What are the resources that are available to us? And we have our occupational health updates and our testing information that changes as the situations change with them. Our infection control colleagues and the updates on the PPE guidance and how our practices change as we gain more and more information. And then of course, our daily COVID-19 management update email that keeps us informed and in control. So when we're at work, we know what's happening. So it's just a helpful way to think about information for us. And then finally, a big category, and not finally, a big category is helping you work with this through the stress, the anxiety, and other feelings and emotions that might be going on with you as you face this as a healthcare worker in our organization. Next slide, please. Oh, sorry, this was a little bit out of date. Okay, so this just is an overview of what we do here. We talked about it already, the Centralized Wellness Resource Hub, and I would point you to that. And the Stanford Wellbeing Consortium that we're part of. And for those of you who are unable to see our grand rounds last Monday, this session, Managing Stress in Turbulent Times, is actually recorded and on our COVID website for your review. Next slide. Okay, there we go. Hemant, would you like to discuss this slide?
Sure, thank you, Christy. So as Christy was mentioning, a lot of our focus as a team has been to cultivate resources to help you cope and looking at this holistically and really collaboratively. And so you'll be hearing in a few minutes from some of the groups that we've reached out to, who've reached out to us to come up with a multitude of offerings that will help us each cope in the ways that we find most helpful. And that's important because not every one of us will find the same resource helpful. And so for some folks, it may be that to relieve their stress, exercise, physical fitness may be most helpful. And so on that Wellness Hub on the intranet, there are some online free offerings of exercise and physical fitness resources that you can access. From a mindful mentor standpoint, you'll be hearing shortly from Vicki Friedenberg about the wonderful work that her program is offering through the many mindful mentors now trained and ready to help throughout the institution. You'll also be hearing from Randy Streisand, the Chief of Psychology and Behavioral Health, about a really innovative opportunity that they have developed on behalf of our psychologists. You'll be hearing from the chaplaincy services about the resources that they've developed, as well as from the ethics program about consultation services available through that program. And Aetna EAP also has many resources available, as well as others through HR, which you'll be hearing about shortly as well. All of these evolved under the umbrella of well-being because we recognize that at Children's National, there are so many teams, so many groups that really were waiting and looking for ways to help our colleagues out. And so the purpose of this is to show kind of that story of how we've each collaborated in our different ways to bring these services to the organization. One of the things that we launched immediately at the outset of COVID-19 was an extension of our meals and meditation program. And because we can't do this in person, they're now virtual. And every day, twice a day at 12 noon and at 10 p.m. through Zoom, 7 days a week, all staff at Children's National can access a virtual meditation, a virtual guided meditation. Our partners in the Stanford Wellbeing Consortium love this idea, and we then extended that invitation to all of them. And later today, we'll be extending the invitation to join our Zoom twice daily sessions to all of the leaders in the Children's Hospital Association that Dr. Newman had mentioned. These sessions are led by senior instructors from the Art of Living, as well as our very own meditation instructors, Vicki Friedenberg and Linda Herbert. And the link is shown here. And we hope that you can take advantage of this opportunity whenever your schedule allows. Next slide, please. Next slide, please. Thank you. So another, collaboration that has evolved out of this challenging time has been trying to think about what we can do more broadly for healthcare workers all throughout the United States. Obviously, many of the resources that have been developed are specific for our colleagues here at Children's National, but the Art of Living Foundation wanted to work with us on something that could be available to all healthcare workers at no cost. And this is a program that we've implemented here at Children's National with some of our healthcare workers last year. And we found that this breathing program, it teaches very basic breathing techniques just in a few short minutes, that it immediately decreased emotional exhaustion, it decreased anxiety. And so now it's in an online format. And we have made this available to all Children's National healthcare workers, as well as all of the healthcare workers throughout the entire US and Canada. And since the launch last week, over 1,200 healthcare workers all throughout the US and Canada have learned these breathing techniques to help them cope. The link is shown here, and all that you have to do is register with your license information, and then it immediately takes you in to the practices that really, if all that you have is a few minutes, just tapping into the breath is such a powerful tool to calm our fight and flight response, to help us manage stress so that we can be better leaders and better healthcare providers. Next slide, please. So now I'd like to turn it back to Christy, who's going to mention some of the upcoming well-being initiatives and collaborations that we have planned.
Thanks, Heyman. As a part of our future thinking, we're trying to determine what and how to meet the goals of and the needs of our care teams. And so we just had our provider wellbeing committee meeting, and these 3 items were discussed. And we're hoping to roll out team-based virtual listening tours where we can actually have opportunities to talk to our teams on the front line, particularly highlighting those teams that are most critically involved, such as our ER colleagues, our anesthesia colleagues, and the ICUs, to check in with them, hear how they're doing, and to see if there are some things from an organizational standpoint or a systems-based standpoint that we might be able to help with them. The second thing, along with our partners, we're hoping in our Mindful Mentor course, as well as our psychology colleagues, is to talk about the debriefing infrastructure. Can we do real-time crisis management when our colleagues may need that? And of course, that will also be done hopefully with our other colleagues who do this on a daily basis, such as our chaplains and our ethics professionals as well. And then finally, just giving thought to that unthinkable, when a COVID positive colleague tests positive, what kind of outreach do we have for them during their time away from the hospital? And our colleagues at Stanford have introduced a program that sounded like something that we could adapt here at Children's National. And we look forward to touching base with you in a few weeks to talk to you about what we have proposed along those lines. Next slide. So our colleagues in Human Resources, you have the next slides.
Thank you. I appreciate it. So first and foremost, I'll dive right into the Employee Assistance Program, since we've touched on that a little bit. So the Employee Assistance Program is open to all staff across Maryland, the district, and Virginia. Whether you're teleworking, whether you're in clinical care, this is a resource that's available to you. The first piece is the confidential counseling. So you can have up to 6 sessions of confidential counseling. And this is really easy to get to. You can see this website here. You type it in. Your username is children. Your password is EAP in caps. Very easy to get in. And you can also call 24 hours a day to set up time to talk to someone. The other resource that's inside the Employee Assistance Program is there's a lot of webinars and articles in there. Things like how to stay connected in a virtual environment, avoiding stress and burnout, new research that comes out, lots of little tips and pointers in there that you can flip through something in a couple of minutes time to get some guidance. The second piece is the live and recorded online seminars. So there are four seminars. They're each about 45 minutes. This is in the Live Well portal. So for those of you that do the biometric screening where you're doing the little questionnaire to get the discount on your health insurance, this is in the same place. And there are some online seminars that you can take. You can see a couple of topics here. So stress management, coping with anxiety, resilience, managing emotions under pressure. And as we come across new opportunities and seminars, we'll continue to add them there. The next one, my favorite, live yoga classes. I'm sure, like me, most of you are working out via a video in your living room or at home somewhere. And the live yoga classes are great. They're doing those on Mondays and Fridays at 12 and on Wednesdays at 4, and they're via Zoom. So you'll feel like you're in a workout class a little bit, as much as possible, and you can do those yoga classes. And then last, I'd be remiss if I didn't touch on childcare. The childcare page, I'll tell you, it evolves, I feel like every day. We've got some Children's National resources there that you can take advantage of, but also every time someone in the community, Maryland District and Virginia, reaches out to us, we have a team that's calling those individuals to vet it, if you will, make sure that it's a great resource for us. And as we do that, we're adding it to the childcare page so that way you have both internal and external options. And if you reach out to the childcare team, you'll see their contact information there. They can help guide you towards what might be best suited for your needs. So it doesn't necessarily just have to be our program. They've researched all the programs that are out there and can help you with that. All right. Next group I'm going to hand it over to is our chaplains. Thank you.
Follow the rules. Hope everybody's doing well today. I'm Kathleen Ennister, Senior Manager of Chaplaincy Services here. I wanted to kind of capture on one slide many of the things that are rolling out from Chaplaincy Services. This is not everything. There are flyers that have been sent out to our frontline staff and directors, managers, supervisors, and are available in hard copies and posted throughout the hospital as well. But in relationship to one of our big projects, the Comfort Corner, we're trying to find ways to do that a little bit differently so that the carts are not moving from unit to unit and possibly being a mechanism for infection spread. So we're trying to do a variety of things of putting things into the hands of our frontline providers, some of the same resources that we have available during Comfort Corner times. we're actually doing in small individual bags to give out to our frontline providers. One of the things I can tell you is that we're making little bags of aromatherapy, and we cannot keep up with the dispersion of them. So apparently aromatherapy is a great relaxer for some of our frontline staff. We have some Zoom things going on regularly. This afternoon at 3 o'clock and every Monday at 3 o'clock, there will be a live concert with our chaplain, Eleazar Oliveira. 15 minutes, just an opportunity to tune in and get some relaxing, calming live music and hopefully turn our minds away from maybe what's right in front of us to something a little bit lighter and a little bit lighter in different ways. We also are doing a reflection and prayer time by Zoom, Tuesdays and Fridays at 10 a.m. We're doing some activities in the Healing Garden that we are trying to advertise as social distancing activities, but we have some ways in which we're supporting staff through activities out in the Healing Garden on Mondays and Thursdays from 12:30 until 1:30. Christy was mentioning the debriefing in crisis. The program that is being worked on through multiple disciplines throughout the hospital, we've decided recently to call CALM, and it's kind of our response to the critical incident debriefing, to the Code Lavender, to the second victim kind of support. We have managed to train a great number of our staff, and we're presently working very hard to get a dispatch system in place so that those teams can be dispatched 24/7 for crisis support. So you'll hear more about that as we get some of the details worked out. We're also trying very hard to make sure that resources are getting to some of our staff who don't have access to hospital email or to a computer. So we have some other virtual resources that can be accessed through a smartphone. We do regular emailings. Many of you who are here in the room and probably listening to me get our grace notes. That's expanded considerably during the last couple of weeks, as well as our individual counseling services with our frontline staff. We've been spending a lot of time at the bedside with our staff and in our offices with staff as well. So there are many, many more options for you than probably you see right in front of you. I encourage you to give me a call if you think there's something that we might have available or something you think we should have available. You can reach me. The information is on the slide. Also directly through my email or through the email spiritualcare@childrensnational.org. Let me wash my hands.
I think there was another slide before this. I wanted to show off, there it is. I wanted to show off the picture of our two cohorts of Mindful Mentors. Hi, I'm Vicki Friedenberg, and for the next couple minutes, I want to tell you about our Mindful Mentors program. You can see on this first slide our fabulous group of mentors, and I just want to tell you about a few things that we have going on right now to help people get through this time. But a little background first. So the Mindful Mentors are a team of staff who have either completed or in the middle of a 12-month program, an intensive interactive educational program in mindfulness education. So the program starts with 16 hours of intensive education, and then the rest of the year is followed by monthly debriefings and support group meetings with the group, as well as a couple of other more intense educational offerings throughout the year. So the primary goal of the program is to educate clinicians and other hospital staff in mindfulness-based approaches to help them improve and develop their own mindful awareness and self-care to improve their own lives, to increase their own ability to manage their stress, and also to become more mindful caregivers and to learn how to teach these mindful techniques to other staff as well as to their patients and families. So currently we have 90 staff who are in the Mindful Mentors program from multiple departments, both clinical and non-clinical, here at the main campus, and also a couple of satellite sites such as Children's Health Center and the Montgomery County ROC have Mindful Mentors. Our group is comprised of RNs, MDs, child life workers, social workers, psychologists, administrators, management staff, music and art therapists, and even our fabulous librarian. So at this time, our mentors are providing a lot of activities for the staff in their areas, such as mindful moments, or brief meditations or meditation sessions, either before, at the beginning or end of staff meetings, before and after clinical rounds, sometimes during clinical handoffs on the units. Many of our mentors have been trained in drumming for relaxation and healing, and we've ordered several drums that are now on 12 of the units or clinical areas. And some of the units have even had breakout musical sessions to help decrease the stress on their staff at the time. I also send out a mindfulness quote of the day every weekday morning to many of the hospital staff to help people start their day with a centering thought. So if you would like to be added to the distribution list for this mindfulness quote of the day, please let me know. I'd be happy to add you to the list. Our list has grown to greater than 2,200 people, and happy to keep it growing, growing, growing. Also, something coming down the pike very soon are going to be Zoom art making sessions for the staff. Even I've been assured that even people like me who have zero artistic ability will be able to enjoy and do and have fun with these activities. This initiative, we're just waiting for our supplies to arrive from Amazon. They've all been ordered, and this initiative is being led by Heather Themis, who's one of our art therapists and mindful mentors. And you'll be hearing a lot more about this soon. This is being, the supplies are being funded by the Core Values Awards that the Mindful Mentors was given. So we're really excited about that. Heather and her art therapy colleagues have also created grab and go kits for nurses and other staff that are ready now. So if anybody wants a grab and go kit to have a little mindful time, please let Heather know and she'll make sure that you get one. Also, if you don't happen to have a mindful mentor in your area, please let me know, and we will make sure that we will come to you and give you some tools to help you get through this time, teach you some mindfulness techniques, work with your staff, and do some programming with your staff as well if you don't happen to have a mindful mentor in your group. I think that's it. Thank you for all you do. Please let me know if there is anything that we can do to help you in any way. If you have any ideas, any suggestions, we're happy to hear it all and to come help you in any way we can. Stay safe and healthy.
Thank you so much to our speakers. I'm going to shift now to our Zoom, and Dr. Streisand is going, who is the Division Chief for Psychology and Behavioral Medicine, is going to give us an update on what they're doing to support employee wellness and employee health and well-being. Randy, are you on?
I am on, yes. This looks like it's Vanessa's slide for ethics, so you can either forward ahead.
Hang on one second. We can move forward.
Okay.
Sorry.
That's okay.
I had a different slide deck. I apologize for that. Okay, there you are. We'll go there, and then we're going to come back to Vanessa. Thank you.
Great. Okay, thank you. It's really wonderful, excuse me, to hear about so many different ways that providers and staff at Children's are able to seek out some self-care for themselves. It's just been really amazing to hear about all the different resources. And I want to thank the leadership team as well as the provider wellness group for really highlighting all of these. I think that it's great to hear from leadership the importance of us being able to take care of ourselves in order to best care for the children and families in the community with whom we work with, and not just care for ourselves physically, but really pay attention to the more social and emotional aspects of our well-being. So thank you all for highlighting all these important efforts. So I just have one quick slide, if you could move that forward. And like the other programs that we've heard about, this is another initiative to provide support to any employee through Children's National. And our psychology faculty have volunteered time in order to provide one-on-one consultations by Zoom. These are 30-minute time slots, and we have them available from Monday to Friday, 9 a.m., 9:30 a.m. in the morning, and again, 9 p.m. and 9:30 p.m. in the evening. And the point of these is not to provide ongoing therapy, as we heard from Amy Beals, that you can really seek out ongoing treatment, 6 sessions through the Employee Wellness Program and the EAP program. This is really for more briefer consultations, checking in about any kind of challenges that are going on, whether it be work-related or what's going on in your family life and caring for children at home, or challenges with juggling all of the added demands that so many of us have now during this unusual time period. So it's very easy to schedule one of these. We rolled this out last week and already have had several folks take us up on this new program. You just have to email psychology@childrensnational.org with your preferred date and time, and we'll get back in touch with you and get you scheduled for a Zoom consultation. And that's it.
Madrigal from the ethics program. I echo Dr. Streisand's words on the learning about all the different things that are available to our staff, and it's really, really wonderful to see this group together. I'd like to just share with you a little bit about what our ethics program response has been, who we are, what we can offer, and how we're doing that. So just a little bit more about our Children's National Program. My right-hand woman currently, Meg Menzel, who is the System Program Director. She's terrific. And then I have several who are on the kind of executive council, including Kathleen Ennis-Durst, who's actually wears both hats with chaplaincy, and Matt Sloniger, in addition to Kathy Dubois from nursing as well. In addition to that small group, we have a large committee, ethics committee, about 30 people large, and with a lot of ethics expertise that comes to the table there. In addition to that, we are also part of a DC Ethics Consortium, and this group has been around for a long time and has been recently reinvigorated, and includes ethicists and committee chairs from all over the region, from Inova, from Georgetown, from GW, and others. And there's been a lot of really terrific discussion and awareness of kind of what's happening ethically around the region. And so we have been part of those discussions, and that has really been terrific. So what can ethics do, and how can we contribute? And I think one thing is we are here to recognize that a lot of the questions that are currently happening involve and invoke questions of morality. And the ethics program gives space for that and allows for us to be able to sit down and have some of those discussions. It kind of messes fundamentally with the ideas of who we are, what we do, and how we do it. We also help normalize and name some of the emotions. So I am afraid of contracting COVID. I feel guilty about not being on the front lines. I feel guilty about not wanting to be on the front lines. I feel moral distress about about asking to compromise my standards of care for any reason, be it shortages of PPE, drugs, or supportive technologies. So something else is we are here to acknowledge some of the things that you are reading in the lay literature and reading in the scientific literature. So every other day, something comes out in the New York Times, the Washington Post, the Atlantic, a New England Journal of Medicine, talking about the ethics related to COVID-19 and the ethics of whether it's triage or resource allocation. And so we're here to talk about some of those issues and talk about what that looks like. And part of that is providing kind of an ethics framework. So where do some of these things come from? Some of you may have heard of the Maryland Project, this deliberative democracy that came together to try to understand what is the best way to triage resources if we need to. And kind of where does that come from and what ethics principles like utilitarianism and other things have been put into play when we think about the unthinkable. And I mean, I think the most important kind of human aspect in terms of the ethics framework is looking at when we talk about ethics, the imperative that we tell each other the story of our own lives, stories that explain what we believe, why we have come to believe them, in hopes that we can understand each other. So how can ethics help? We've, similarly to our psychiatry colleagues, we are setting up Zoom office hours with an ethics consultant. You can reach out to us and we'll, anytime. Our contact information is up on the top right corner. We have email and a pager number, and of course, you can reach out to any of us individually if you see us in the hallway or send an email to us directly. We also offer consultation to any small groups. We've gotten consults from different research groups about including concepts of COVID-19 into their research protocols. We've gotten consults from groups about innovation, about different concerns that they have just to run through. Is this okay from an ethics perspective? So we're happy to do that anytime, and it's easy to set up a Zoom phone call. And of course, we have 24/7 clinical consultation that continues to be fully available to everyone. And most importantly, we're available to faculty, staff, trainees as always, but we're also available to families and patients, which I think is a little bit of a different spin than others. So if you hear of families and patients that you think could benefit from an ethics consult, guide them on how to reach out to us, and we are happy to walk them through different things as well. So I thank you all for your time. I really appreciate it. Thank you.
Kurt, we'll move into Q&A if that's okay. Shadon, if you can advance the slide.
Well, thank you, Vanessa, and all the rest of the presenters. I know it was brought up earlier. I can't remember who mentioned music. Was that you? Was that Kathleen that mentioned music? And we have a wonderful music program through the chaplain's service. And I know Martha, you've been bringing in, Martha Para is bringing in lots of music. Did I see that we had some celebrities that were in the Seacrest studio, and that got picked up all over the
Every other day, there's some
the country. But you know, we have our own musicians as well, besides on the chaplain services and in the Seacrest studio. And Vanessa, Dr. Madrigal, is one of those. I had the opportunity to hear Dr. Gil Warnowski and I forget the name of the orchestra. The Baby Blue Sound Collective, and this was just an amazing concert of not only people from here that are physicians, nurses, all different occupations, but from across the world. I mean, there was one from Australia, I think, and they were all, and there were a number of people from here, but it was spectacular. And Vanessa is just a wonderful singer. I hope you all get a chance to hear her sing. I saw some of the concert, well, not really a concert, yesterday from the, Andreas Bocelli, in front of the Milan Cathedral. I mean, if you should go online and try and find that. It was so inspiring. And maybe get one of those aromatherapy pods and pop that. No, I'm just kidding, But there's so many ways we should be taking advantage of these incredible resources that our leaders have put together. A lot of them were suggestions from you. And, you know, I'm going to be looking for that yoga deal. Now, do you have to, is it live on Zoom at noon? So you have to get your office, get your mat out in your office or wherever you are and take advantage of that. That's terrific. What?
I promise not to come into your office.
Look, I'm doing yoga. My wife and I are doing it twice a week on Zoom. I mean, with our regular yoga, with our regular person, but it is at home, David. It is at home. But I will be bringing a mat in. This sounds very, very accessible. So, okay, we have some questions.
We have
and
two
Dr.
questions,
Shaw
Kurt.
is our question man once again.
A little spin today. I'm going to ask myself the question.
Ooh.
All right. Should staff be wearing face shields instead of goggles when performing the swab for testing for COVID? And I will answer yes. Oh, thanks, Kurt. Yes, we follow CDC guidelines for aerosolizing procedures such as a nasopharyngeal swab for COVID. We want to make sure you're wearing face shields and the N95 mask.
So the answer to the
is
question
yes, wear your face shields.
Wear the face shield. Okay.
Then the second question, Kurt, or for Dr. Wessel, however you wish, how are we tracking COVID-19 cases at Children's National? Are we looking at demographics, zip codes, et cetera?
The answer is yes. We are tracking all of the patients carefully. We're centralizing them into a database that we validate and do some lab checking. And we also know the specifics of what unit they're admitted to.
And then, David, there was a follow-up question. And Kurt, this would be the last question that came in.
Mm-hmm.
Dr. Wessel, if you could provide updates on employees or testing statuses.
Employees.
Employee testing.
Well, just the update on the patients. We have had 5 admitted to the intensive care unit. Most of those patients do have comorbidities, although not 100% of them, but the vast majority do. 4 out of 5, I think, have had comorbidities that would be described. And I think Robin has the details on our occupational health numbers.
Thank you. So we currently have 57 employees at Children's National who have had a positive COVID test. And that number appears to be slowly going down, the number of new employees testing positive every week. So we feel good about that. And of those 57, 21 have been cleared to come back to work already, so fully recovered and are back to work as of today.
Great.
Well, that's terrific news. I know not all the hospitals are sharing the information as openly and transparently, and so Robin and the rest of the team, thank you for that. I have some late breaking news. We were able to, this was actually sent in by Tara herself. I'm assuming that the picture of the 2 children matches up with the saying, Tara, you'll have to tell us if you were the baby on the left and your sister was the baby on the right, because that's how it lines up in our on our slide. But there the 2 girls are, and the picture of their mother holding them, actually you could see their mother who, and this was back in 1977, Tara disclosed that as well. So and then we learned that Dr. Short did arrive here in 1977. So it's possible, but we are not sure. Tara and Dr. Short will have to let us know whether Dr. Short was involved in their care in 1977. So anyway, great stuff. Is there another slide to follow that, or is that that's the last slide? So if anybody else wants to send their pictures of having been in the at Children's, I'm sure there's other people that work here at Children's that may have been a patient here over the years. This might be kind of a way to bring that forward if you're comfortable doing that. I just want to come back to the ethics discussion, because I think that is a terrific resource. There's a lot of new situations and scenarios that are coming forward that this is so unprecedented. And so having a world-class ethics program that involves not just the patient issues that we're classically thinking about, but more broadly, maybe it's around the family, or maybe it's around the caregivers feeling like they want maybe some answers, or they're not quite sure of where to turn. So Vanessa, that's, I think that's a great dimension that there's some comfort, and you should explore those as well. But if you are concerned about something, or that the hospital needs to be, involved in a different way, and you're really worried about what's happening, that's a great opportunity to get more information. Did you want to highlight anything more?
Sure. I'll just add that there's, I think ethics programs across the country are stepping up to answer and help people understand these questions, both from how the framework and how the decisions kind of have come historically and help inform where we are today, to kind of understanding the human piece on the everyday individual and how each person can deal with those distresses.
Okay, thank you for that. Kathleen, any last words? Can we get a microphone over there? Or Vicki, any last thoughts about?
I'd say check out the YouTube site, which is non-branded. Nothing is identified as coming from Children's, but it's a lot of resources that we have placed there. It's called Chaplaincy Services on YouTube. Look and see what's there.
And if you didn't already know, our chaplaincy services are really leading in terms of children's hospitals, if not in all hospitals. I had the opportunity, when was that? It seems like maybe a year ago, 2 years ago now, they had the national meeting here of all the chaplain services, and I was really proud to be the CEO over that. There's a little inside joke that I've got going with Kathleen on that, but I was proud to be the CEO over that chaplaincy service. Now, I don't know if they can see a little, I'm putting an arrow on Tara there. And Tara, if you're listening, I'm going to put the arrow on what we think is you.
No, wrong.
Wrong. So this was Tara.
Yeah, she said notice the bald spot. She's still mad about the PIV they tried to.
Right up there. If you didn't hear that, this is for our risk management team. But Tara is upset about this. They shaved her head to put this IV, which is what they used to do in those days, put an IV in her scalp up there. But there's no evidence. Just for the risk management team, it looks pretty good. Pretty good right there. Tara, we are so thrilled that you're a leader here and that your mom would write that letter. That just is so meaningful. We'll be following up with you on the big question now. The big question: was Dr. Short responsible for the IV? So, with that, everybody, thank you. I look forward to catching up with you for Wednesday.
Thank you, Kurt.